हेलो दोस्तों, स्वागत है मेरे इस यूट्यूब चैनल पे। आज हम लोग पढ़ेंगे रैशनल यूज़ ऑफ मेडिसिन। इसका इंट्रोडक्शन देखते हैं। इसमें क्या है? व्हेन ए पेशेंट कंसल्ट्स फिजिशियंस फॉर ट्रीटमेंट ऑफ अ डिजीज, द फिजिशियन prescribe medicine. The treatment must include the correct medicine in the correct dose, which must be lower price but also effective. If too many medicines are prescribed, it may it may result in overuse which is not required. So, drug use must be proper for the treatment of disease. The WHO defines the rational use of drug as given below. रैशनल यूज़ क्या है जो WHO के द्वारा डिफाइन किया गया है, वो हम लोग आगे देखेंगे। Medications appropriate to their clinical needs in doses that meet their own individual requirement for an adequate period of time and at the lowest cost to them and their community, जो कहा गया है WHO के द्वारा 1985 में। Common types of irrational use of medicines are use of too many medicines for one patient, called polypharmacy; inappropriate use of antimicrobials, often in inadequate doses for non-bacterial infections; use of injection when oral formulations are more appropriate; failure to prescribe in accordance with clinical guidelines; inappropriate self-medication of prescriptions only medicines; irrational use of drugs results in morbidity, mortality, adverse drugs reaction, ADR, poor outcome of cure, control, prevention of disease, antimicrobial resistance, and financial loss. For example, the irritation use of medicines to treat infectious disease has resulted in the emergence of drug resistance in the microorganisms. इसका एग्जाम्पल क्या है? एग्जाम्पल इंक्लूड इमर्जेंस ऑफ क्लोरोक्विन रेजिस्टेंट falciparum malaria in 90% countries and 2 to 40% primary drug resistant tuberculosis, and many more. Steps taken by WHO towards the promotion of rational drug use. With a view to promote the rational use of medicines, WHO in 1977 established the first model list of essential medicines to assist countries in formulating their own national lists. In 1989, the International Network for the Rational Use of Drugs, जिसका शॉर्ट फॉर्म है INRUD, International Network for the Rational Use of Drug, was formed to promote more rational use of medicines. The core interventions to promote more rational use of medicines: a mandated multidisciplinary national body to coordinate medicine use policy; clinical guidelines, essential medicines list based on treatment of choice, drugs and therapeutic committees in district hospitals; problem-based pharmacotherapy training in undergraduate curricula; continuing in service medical education as a licensure requirement; supervision, audit and feedback; independent information on medicines; public education about medicines; avoidance of financial incentives; appropriate and enforced regulation, sufficient government expenditure to ensure availability of medicines and staff. Among these, the very important one have been explained clinical guidelines, standard treatment guidelines, prescribing policies consist of systematically developed statement to help prescribers make decisions about appropriate treatment for specific clinical conditions. Evidence-based clinical guidelines are critical to promoting rational use of medicines. Essential medicine list ऐसा कौन सा दवा है जो एसेंशियल है उसका लिस्ट हम देखेंगे एसेंशियल medicines are those that satisfy the priority healthcare needs of population जो एक पॉपुलेशन को हमेशा ज़रूरत होती है हेल्थ प्रायोरिटी के हिसाब से नेशनल EML essential medicine should be based upon national clinical guideline and EMLs should be regularly updated and therapeutics committee in districts and hospitals a drugs and therapeutic committee DTC drugs and therapeutic committee also called a pharmacy and therapeutics committee is a committee designated to ensure the safe and effective use of medicines in the facility of area under its jurisdiction. Establishing such a committee in hospitals will promote the rational use of medicines, and such committees are well established in industrial countries. Continuing in service medical education as a licensure requirement. Continuing in service medical education is a requirement for licensure of healthcare professionals in many industrialized countries. Need not be limited only to professionals, medical or paramedical personnel, but may also include people such as medicine retailers. Problem-based training in pharmacotherapy in undergraduate curricula. It has been suggested by WHO that basic training in pharmacotherapy for undergraduate medical and paramedical students can significantly influence future prescribing. Rational pharmacotherapy training linked to clinical guidelines and essential medicines list can help to establish good prescribing habit. Independent medicine information. The only information about medicines that practitioner receive is provided by pharmaceutical industry and may be biased. Hence, providing independent, unbiased information to the practitioner is very essential. Drug Information Center (DIC) and drug bulletins are two useful ways to spread such information. Public education about medicines. Public must Public must be provided with the knowledge about the risks and benefits of using medicine and when and how to use them. Only then people will get the expected clinical outcomes and not suffer from the adverse effects. Therapeutically sound and cost-effective use of medicines by health care professionals and consumers can be achieved at all levels of the health system. A sound and Rational drug use program in any country has three elements. कौन कौन सा element है? Strategy for the rational use of medicines and monitoring. This support the countries in implementing and monitoring a national strategy to promote rational use of medicines by health care professionals and consumers. Rational use of medicines by health care professionals, developing national standard treatment guidelines, essential medicine list, educational programs, and other effective mechanisms to promote rational medicine used by healthcare professionals. Rational use of medicines by consumer. Establishing effective medicines information system to provide correct medicine information to the consumers. All these steps, if properly followed, then rational use of drugs becomes effective even in developing countries. Thank you.